In southeastern Wisconsin, we have many level 3 and 4 trauma centers, but we have only one adult level 1 trauma center, and that's at Froedtert Hospital. Trauma centers are validated by the state of Wisconsin because of the amount of resources that are needed. And here in the state of Wisconsin, we recognize 4 levels of trauma centers. So a level 4 center would have the least amount of resources, and a level 1 center would have the most amount of resources. In 2024, we saw at our center more than 4,500 injured patients. But the number one reason for injuries we see at our center is falls, followed by motor vehicle collisions. We also have high rates of penetrating trauma and even industrial injuries. So we know that when a patient is severely injured, that getting to a level 1 trauma center within the first hour can mean the difference between life and death. Their evidence actually supports that going to a level 1 trauma center when you are severely injured can reduce your mortality by as much as 25%.
Research is so vital for trauma care, not only to address survival rates, but to address other really important outcomes for our patients. And so research helps us really address, what puts somebody at a greater risk of poor quality of life, what impacts their mental health after injury, and research can really shape then changes to practice to address those needs for our patients. Not everybody recovers from injury in the same way. Everybody is unique in terms of what they bring to their experience, as well as how they experience healthcare themselves. And so with this knowledge, we've been able to use research and really consider ways we can improve and enhance care to be more patient-specific, identifying what that patient's specific needs are, and then pulling in practices that might help them specifically recover from injury. And so in this way, we're really driving forward patient-centered care by tailoring care to individuals themselves.